Question 1. Which patient should the nurse assess first when receiving the shift report on a heart failure unit? A. A patient with chronic heart failure reporting fatigue. B. A patient with new onset confusion and restlessness. C. A patient with bilateral leg edema. D. A patient scheduled for a routine echocardiogram. Answer. B. A patient with new onset confusion and restlessness. Question 2. A nurse is delegating tasks for a patient with heart failure. Which activity is appropriate for a UAP? A. Administering furosemide. B. Educating about low-sodium diets. C. Monitoring daily weight. D. Assessing for jugular vein distension. Answer. C. Monitoring daily weight. Question 3. A nurse is caring for a client with left-sided heart failure. Which symptom is the priority to report? A. Fatigue and weakness. B. Dyspnea with crackles in lungs. C. Weight gain of 2 pounds overnight. D. Mild orthopnea when lying down. Answer. B. Dyspnea with crackles in lungs. Question 4. Which task is best assigned to an LPN/LVN caring for a heart failure patient? A. Administering furosemide. B. Evaluating the patient's response to medications. C. Reinforcing dietary teaching. D. Performing discharge planning. Answer. C. Reinforcing dietary teaching. Question 5. A patient with heart failure is receiving digoxin. Which finding is most concerning? A. Apical pulse of 58 BPM. B. Potassium level of 4.2 milliequivalent/L. C. Mild nausea. D. BNP level of 150 pg/ml. Answer. A. Apical pulse of 58 BPM. Question 6. A nurse is reviewing lab results for a heart failure patient. Which value is most important to monitor when on furosemide? A. Sodium. B. Potassium. C. Magnesium. D. Chloride. Answer. B. Potassium. Question 7. Which action should the nurse take first for a patient with heart failure and oxygen saturation of 85%? A. Elevate the head of the bed. B. Notify the physician. C. Administer morphine. D. Check ABG levels. Answer. A. Elevate the head of the bed. Question 8. What is the most accurate method for evaluating fluid balance in a patient with heart failure? A. Measuring intake and output. B. Monitoring vital signs. C. Assessing skin turgor. D. Daily weight measurement. Answer. D. Daily weight measurement. Question 9. Which intervention can be delegated to a UAP caring for a client with acute decompensated heart failure? A. Auscultating lung sounds. B. Assisting the patient with ambulation. C. Adjusting oxygen flow rate. D. Teaching about medication adherence. Answer. B. Assisting the patient with ambulation. Question 10. A heart failure patient is scheduled for discharge. What is the nurse's priority action? A. Schedule a follow-up cardiology appointment. B. Provide written discharge instructions. C. Ensure the patient understands weight monitoring. D. Confirm prescriptions are sent to the pharmacy. Answer. C. Ensure the patient understands weight monitoring. Question 11. Which finding in a heart failure patient indicates the need for immediate intervention? A. Cough with frothy sputum. B. 1+ ankle edema. C. Increased fatigue. D. Dry mucous membranes. Answer. A. Cough with frothy sputum. Question 12. Which teaching point should the nurse prioritize for a patient with newly diagnosed heart failure? A. You should avoid all dairy products. B. Weigh yourself daily at the same time. C. Limit potassium intake to prevent complications. D. Increase your fluid intake to prevent dehydration. Answer. B. weigh yourself daily at the same time. Question 13. Which medication should the nurse question for a patient with heart failure and bradycardia? A. Lisinopril. B. Furosemide. C. Metoprolol. D. Spironolactone. Answer: C. Metoprolol. Question 14. A patient with heart failure reports sudden weight gain and shortness of breath. What should the nurse do first? A. Administer furosemide. B. Assess lung sounds. C. Notify the healthcare provider. D. Ask about dietary intake. Answer: B. Assess lung sounds. Question 15. The nurse is caring for a heart failure patient prescribed enalapril. Which adverse effect should be reported immediately? A. Dry cough. B. Dizziness. C. Swelling of the tongue and lips. D. Fatigue. Answer: C. Swelling of the tongue and lips. Question 16. The nurse notes 3+ pitting edema in a patient with right-sided heart failure. What is the priority assessment? A. Skin integrity. B. Blood pressure. C. Lung sounds. D. Abdominal girth. Answer: D. Abdominal girth. Question 17. The nurse is delegating tasks on a heart failure unit. Which task is most appropriate for the RN? A. Measuring urine output. B. Reassessing response to diuretic therapy. C. Feeding the patient lunch. D. Assisting with hygiene care. Answer: B. Reassessing response to diuretic therapy. Question 18. Which discharge instruction is essential for a patient with chronic heart failure? A. Weigh yourself once weekly. B. Avoid all physical activity. C. Report a weight gain of more than 2 pounds in a day. D. Take furosemide only when you feel short of breath. Answer: C. Report a weight gain of more than 2 pounds in a day. Question 19. A patient with heart failure is restless, dyspneic, and has crackles. What is the nurse's first action? A. Increase 4 fluids. B. Administer prescribed diuretic. C. Apply compression stockings. D. Document the findings. Answer: B. Administer prescribed diuretic. Question 20. Which lab result should the nurse prioritize for a patient on digoxin and furosemide? A. Hemoglobin. B. Creatinine. C. Potassium. D. Sodium. Answer: C. Potassium. Question 21. A nurse is reviewing discharge instructions with a patient with heart failure. Which statement requires correction? A. I will weigh myself every morning after I urinate. B. I will avoid adding salt to my food. C. I will skip doses of my medication if I feel better. D. I will notify my doctor if I gain 3 pounds in 2 days. Answer: C. I will skip doses of my medication if I feel better. Question 22. A nurse assesses a patient with acute heart failure. Which clinical manifestation requires immediate intervention? A. Pink frothy sputum. B. Heart rate of 92 BPM. C. Blood pressure of 140/88 mmHg. D. Mild pedal edema. Answer: A. Pink frothy sputum. Question 23. Which finding in a patient with heart failure taking spironolactone should be reported? A. Potassium level of 5.8 milliequivalent/L. B. Sodium level of 136 milliequivalent/L. C. Blood pressure of 120/80 mmHg. D. Urine output of 1,200 milliliters per day. Answer: A. Potassium level of 5.8 milliequivalent/L. Question 24. Which order should the nurse question for a patient with decompensated heart failure? A. Low sodium diet. B. Encourage fluid intake of 2,500 milliliters per day. C. Furosemide for push. D. Bed rest with bathroom privileges. Answer: B. Encourage fluid intake of 2,500 milliliters per day. Question 25. A patient is receiving digoxin. Which symptom suggests digoxin toxicity? A. Blurred vision and nausea. B. Dry cough and fatigue. C. Increased urinary frequency. D. Weight loss and restlessness. Answer. A. Blurred vision and nausea. Question 26. Which instruction is most important when teaching a patient prescribed furosemide? A. Take the medication at bedtime. B. Avoid foods high in potassium. C. Change position slowly to prevent dizziness. D. Skip the dose if you feel better. Answer. C. Change position slowly to prevent dizziness. Question 27. A nurse assesses a heart failure patient who is receiving 4 furosemide. Which lab should be monitored closely? A. BUN. B. Hematocrit. C. Potassium. D. Glucose. Answer. C. Potassium. Question 28. A nurse receives report on 4 patients. Which patient should be seen first? A. A patient with heart failure and mild ankle edema. B. A patient with heart failure who has not voided in 6 hours. C. A patient with stable blood pressure and crackles at bases. D. A patient with heart failure reporting dizziness after taking diuretics. Answer. D. A patient with heart failure reporting dizziness after taking diuretics. Question 29. Which intervention is most appropriate for a patient with heart failure and orthopnea? A. Increase fluid intake. B. Elevate legs on pillows. C. Use extra pillows when sleeping. D. Encourage walking after meals. Answer. C. Use extra pillows when sleeping. Question 30. Which diet selection indicates a need for further teaching in a heart failure patient? A. Grilled chicken with green beans. B. Tuna sandwich with canned soup. C. Oatmeal with fresh berries. D. Baked fish with steamed broccoli. Answer. B. Tuna sandwich with canned soup. Question 31. What is the primary reason for administering ACE inhibitors to heart failure patients? A. Reduce fluid volume. B. Increase heart rate. C. Decrease afterload. D. Promote vasoconstriction. Answer. C. Decrease afterload. Question 32. A patient with heart failure reports seeing halos around lights. What is the nurse's priority action? A. Assess for hypoglycemia. B. Evaluate for digoxin toxicity. C. Check blood pressure. D. Monitor oxygen saturation. Answer. B. Evaluate for digoxin toxicity. Question 33. Which outcome indicates effective treatment of right-sided heart failure? A. Absence of pulmonary crackles. B. Improved ejection fraction. C. Decreased peripheral edema. D. Decreased blood pressure. Answer. C. Decreased peripheral edema. Question 34. The nurse is teaching a patient about lifestyle changes for heart failure. Which statement indicates correct understanding? A. I will drink 3 liters of water daily. B. I will monitor my weight every week. C. I will limit sodium to 2 grams daily. D. I will take my medications only when symptoms are present. Answer. C. I will limit sodium to 2 grams daily. Question 35. A patient with heart failure becomes increasingly restless and anxious. What is the nurse's first action? A. Reposition the patient to high Fowler's position. B. Administer a prescribed sedative. C. Obtain an arterial blood gas. D. Notify the healthcare provider. Answer. A. Reposition the patient to high Fowler's position. Question 36. A heart failure patient is prescribed carvedilol. Which assessment is most important before administration? A. Heart rate and blood pressure. B. Lung sounds and oxygen saturation. C. Weight and intake/output. D. Urine color and specific gravity. Answer: A. Heart rate and blood pressure. Question 37. The nurse is caring for a heart failure patient on a low-sodium diet. Which snack is most appropriate? A. Salted crackers and cheese. B. Apple slices and unsalted almonds. C. Canned vegetable soup. D. Pickles and deli turkey. Answer: B. Apple slices and unsalted almonds. Question 38. Which complication should the nurse monitor for in a patient with long-standing heart failure? A. Pulmonary embolism. B. Renal insufficiency. C. Hyperthyroidism. D. Liver cirrhosis. Answer: B. Renal insufficiency. Question 39. A patient with heart failure is ordered a fluid restriction. What should the nurse include in the plan of care? A. Provide frequent snacks high in fluid content. B. Allow unlimited ice chips. C. Educate to include all liquids, including soups and ice cream. D. Encourage oral fluids in the morning. Answer: C. Educate to include all liquids, including soups and ice cream. Question 40. A nurse is evaluating teaching on medications for a heart failure patient. Which statement requires follow-up? A. I take my beta blocker daily, even if my blood pressure is normal. B. I stop my diuretic if I have leg cramps. C. I know to check my weight every day. D. I understand the importance of taking my medications consistently. Answer: B. I stop my diuretic if I have leg cramps. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!